Qualcast Nation, we are beginning a new era on our platform. We are putting to rest solvent healthcare, and we are now starting prevention over prescription with Dr. K. This is our rebrand, and you're going to ask yourself, why are we doing this? And it comes down to the fact, like, this is my essence, guys. Prevention, proactive health, how you avoid seeing me in the ICU. This is the passion. When I look back at my career, starting from research, looking at ways at how we reduce our spending and improve the care delivery that we offer our patients, for the longest time, it was looking at ways within ICU. How we use this fluid versus that. Let's use this intervention versus that. Let's use oral antibiotics instead of IV. And all these things, yes, they reduce spending, but they don't move the needle. And what the pandemic taught me was, when we looked at the rates of metabolic disease and poor outcomes of COVID, so by metabolic disease, once again, I'm talking obesity, type 2 diabetes, dyslipidemia, or high cholesterol, high blood pressure. When I saw the links to that, and then finding out that this stuff is preventable or reversible, I should say, that ignited a fire, folks. It ignited a fire. And I was like, we got to do everything we can to empower folks to not get sick, to avoid seeing someone like me in the ICU. Because I'll tell you this, I am tired. I am sad to see folks that come to hospital related to infections from their diabetes or obesity and having the complications that we see. When we collectively as a society, we could do better. We could do much better. US has 87% are metabolically unhealthy. I don't know what the Canadian numbers are, but it can't be that far off. When we look at what we feed our people, our kids, the masses, how we don't move enough, how we're not getting enough exercise, even at a scholastic level or at a school level or at a child's, what we see within our kids. When I see how much little sleep that we're all getting and the stresses that we're adding into our lives, like, the time is now. The time is now to take ownership of our health and to create this movement. And this is why this rebrand is happening. This is why we're doing the prevention over prescription. The rebrand is to ignite shit. Ignite this, ignite that fire that we can do this collectively. It's that important. When we look at metabolic disease, okay, as an example, which we know we can reverse, but we're seeing the impacts on cardiovascular health, strokes, heart attacks, on cancer, diabetes. When we look at links to reproductive health, when we look at psychiatry, like when we look at anxiety, depression, ties to metabolic disease. Like, if we take ownership and we take the bull by the horns here, we could really be transformative. We could change the landscape of health in our country and beyond. And this is what this show is going to be all about, guys. This is the movement. This is the time. We're going to be talking about, obviously, ways to empower yourselves through nutrition, activities, staying active, stress management, creating that sense of community. But we're also going to talk about how we could leverage AI into creating better health for ourselves. We just recently released the Guyata Food Coach app that you'll see links in the show notes. Ways of, like, tracking your bios, getting that feedback so that you can achieve your goals. Take ownership. We obviously started Guyata Nutrition as a supplement for folks that aren't necessarily getting their nutrition needs through conventional ways. So how do you amp up your protein intake? How do you make sure you're getting magnesium to help with your sleep? Fish oil for anti-inflammatory impacts, collagen for your joints to make sure you stay active and moving. Like, this is what we're all about. This is the new movement, folks. Prevention over prescription. We're all in. We're all in on this. You're going to hear more from me. The guests are going to be focused on the topics we just talked about. And yes, there's going to be we're still going to talk about how we can improve things at scale, but it's all in the lens of what we're going to do to avoid seeing myself in ICU. or using that acute care. I hope you guys are with me because I'm excited about this. I've been thinking about this for a long time, and I'm like, we need more juice here. It's been 5 years of jumping on this, and I feel like we're a little stagnant, but this is the kickstart we need, guys. So let me know your thoughts on this. Make sure to follow us, obviously, on Instagram, YouTube, TikTok, at Quadcast. Check out Guided Nutrition. Put in Quadcast 15 for your 15% off the bundles and the supplements. Changing the boogie. Shout out to Sano Living too, our latest partner, Sano Midlife. And Quadcast listeners get 10% off with the link below with the perimenopausal and menopausal health aspect of things. Once again, all these things that we're promoting, all these things that we're getting behind is on that preventative side, on that proactive side, so that you show up as your best self. Show up, guide us strong, baby. Here we go. Let's do this.